Hey, what's up everybody? We are going to do a video about the lymphatic system labs. This is gross and microscopic anatomy of organs of the lymphatic system. And we are going to start with the spleen. This gray guy over here is the spleen. Look at it right next to that kidney, tucked next to that diaphragm. The stomach will be sitting right here, colon under here. But there is the spleen right there. Spleen, of course, filters the blood of old, beat up red blood cells. It's part of your immune response. It's always on the lookout for pathogens. So notice that the spleen has this indented area called the hilum. And at that hilum, we got the splenic artery going in. We got the splenic vein going out. Says our spleen's gross anatomy, pretty quick, pretty straightforward there. You should be able to find the spleen in both of these models, and the splenic artery and the splenic vein. So go ahead and pause that video if you need to. Find those three things. And now what we got here is a microscopic view of the spleen. Like many lymphatic organs, the spleen has a connective tissue capsule around it. We see it up here. Lots of nice collagen in there. And coming inwardly from the capsule are these extensions. We got a nice long one here, shorter one here, some chunks of ones over here. These are known as trabeculae. They're going to help provide that stroma, that internal framework of the spleen. Now, the actual active splenic tissue, there are two varieties. There is the purplish stuff. All the purplish stuff that we see, this over here as well. This is known as white pulp. This is where I've got a lot of lymphocytes, and the white pulp is very much involved in that immune response. Now, the rest of the splenic tissue, so everything that's not a trabeculum or not white pulp, everything else in here is basically going to be red pulp. And red pulp is going to function in that filtration, that removal of old, ugly red blood cells. So no surprise that the red pulp did that. No surprise that the white pulp has lymphocytes, which are white blood cells, and that's what accounts for the purplishness here. All right, another spleen to look at for you. Again, pause this video if you need to, but make sure you can identify the capsule, a trabeculum or two, white pulp, and red pulp. And with that, we're moving on from the spleen to another lymphatic organ, and that is a trio of tonsils. You've got three major tonsils that are forming a ring around the entrance to your pharynx or throat. We see all three major tonsils in this sagittally sliced head here. So here is the nose, here is the nasal cavity, and in this region right here is the nasopharynx. And on the posterior wall of the nasopharynx, we have a pharyngeal tonsil in a really good spot. As pathogens, microorganisms are inhaled, they can crash into this tonsil, and the tonsil is rich in lymphocytes and can help deal with those inhaled pathogens. The other two tonsils are also in good spots. So here's the lips, here's the teeth, here's the tongue, here's the oral cavity. Then at the base here of the tongue, we've got the lingual tonsil. And then right behind the oral cavity, we got the oropharynx here. And inside that oropharynx, on that side wall right there, we see a palatine tonsil. So these are in a very effective position to be on the lookout for any microorganisms taking this oral route here. So pharyngeal, palatine, lingual, those are my three major tonsils. This is the histology of a tonsil. Look how richly purple it is. Okay, that is telling me there is an abundance of lymphocytes. Sometimes we see like just little follicles, little nodules where lymphocytes are packed together. That's what these circles are. So lots of lymphocytes, which makes sense if my job of this organ is to defend against microorganisms. Now we also see a bunch of these white spaces. These white spaces are tonsillar crypts. Tonsillar crypts, I like to think of them as traps for inhaled and ingested microorganisms. They get stuck in these pits, these crypts, and then we can deal with them. There is a capsule, but it's only on this deeper part, because up here where the white space is, that would be the lumen of, whatever cavity, whether it's the nasopharynx or oropharynx or oral cavity, and there has to be epithelium adjacent to that lumen. So there's a capsule, but it's only on the deeper part. All right, let's look at another tonsil, zooming in up close. So we got another tonsil. This is a lingual tonsil here. And I want you to point out the crypt as well as the abundant areas with lymphocytes and then the packed together lymphatic follicles. And then we can move on and look at some lymph nodes. So we got some inguinal lymph nodes here. One of the places where we find superficial lymph nodes, along with the cervical and axillary regions. The green guys here are the lymph nodes. They are lymph nodes. All these little whitish things with the little lines on them, these are lymphatic vessels. So if we pick a single node, we can realize that the lymph is going to be flowing superiorly here. So this guy here has got to be bringing lymph to this node, okay? So this guy has got to be an afferent lymphatic vessel. Probably should have made that blue, right? Let's at least underline it in blue. So this guy is going to be an afferent lymphatic vessel because he is taking lymph towards that node. And then this guy up here is an efferent one. He's taking lymph away. Now I remember why I didn't make them colorful. Because these are relative terms, right? This guy is afferent to this node, but at the same time, he's efferent to this node. So remember, lymphatic vessels carry lymph. Lymph is old excess tissue fluid coming back to the blood. But that lymph can contain microorganisms, cancer cells. The nodes need to filter that out. And we can see in this model here that lymph will pass through multiple nodes on its way. That's going to allow for a more effective filtration. So we got some lymph nodes here. Not a lot of detail on them, but we happen to have a lymph node model cut in a frontal section here. Again, note that we see a connective tissue capsule around it. We saw that in the spleen and partially in the tonsil. Got some trabeculae going inward as well, compartmentalizing the node. We also can see the outer region, which is the cortex, as well as the inner region, which is the medulla. And there are lots of lymphocytes in both of these, lots of B's and T's out here, lots of T's in here, doing the job of filtering the lymph. Now, a couple other things we can note. We can see an afferent lymphatic vessel right here, bringing lymph to this node. We can see an efferent lymphatic vessel right here, exiting from the node at this indentation, which is the hilum. And notice we see valves in here as well. Valves, of course, are going to help me prevent backflow. Valves are necessary. Backflow is a possibility because my lymphatic system is a low pressure one. All right, let's switch gears and look at this lymph node microscopically. So here we see it. Note all the purpleness. Let's go through a few things, starting with this capsule out here. So this is the connective tissue capsule. It's going to send trabeculae in here. I don't see any good trabeculae here, though. That's okay. Now, this is the cortex. Lots of purple, which means lots of lymphocytes, B's and T's in here. I'll see some spaces. The white spaces in here would be cortical sinuses that lymph can flow through. And the flowing of lymph through the sinuses provides an opportunity for that lymph to be examined and for bad things to be filtered out and removed. Now in here we've got our medulla, more lymphocytes in here, kind of clumped together in these things called cords. So these little chunks of lymphatic tissue in here are cords. The white spaces in here would be lymphatic sinuses in the medulla. Okay, I think that's pretty much it for that lymph node. I got another one. Some things are labeled. Can you also find the capsule? I'll give you a hint. It's kind of fallen off on both sides. And then can you see some medullary sinuses and medullary cords? Hint, look in the medulla for those. All right, I got another lymph node here with a lot of things labeled. Can you find the capsule again? Figure out there's a label for it. Find at least one trabeculum. Find the cortex, the medulla. Find some sinuses and some cords. Should be easy because lots of things, everything here is labeled. All right. With that, we're done with the lymph node. This is going to be like the shortest lab video ever. This, unfortunately, sadly, is a infant cadaver here. Fetal cadaver, rather. Not even an infant cadaver. Poor little fetal cadaver. We can see the lung here on the right, the lung on the left. Here's the heart and the pericardium. There's the liver. And see all this stuff here. But we also see the thymus. Fetus has a really big thymus, relatively speaking. The thymus is the site of T lymphocyte maturation. And that's got to get going on early in life. Hence the largeness of size in the fetal thymus, the infant thymus, and the child thymus. Here we see a microscopic view of an infant thymus. Note the richness of the purple. Purplishness tells me lymphocytes. What kind of lymphocytes in this case? They're T lymphocytes because this is the thymus. The T in T lymphocyte stands for thymus, and the thymus is the site of T lymphocyte maturation. And in T lymphocyte maturation, we're actually making sure T lymphocytes respond only to foreign things and not our own body tissues. And we're destroying any that fail to do those two things. Okay, there's a connective tissue capsule. No surprise, we see it on the outside. It has extensions going inward as well. Those are called septa in this case and not trabeculae. Same basic idea though. In this case though, we do notice how there's all these different units within the thymus. Those are called lobules. And we've seen lobules in some other organs as well. Let's look at an adult thymus here in a cadaver. Look at its size relative to the lung, relative to the heart. It's very small. Basically, once it's like you're like a 10-year-old and beyond, your thymus is just going to start to degrade. It's going to get fattier and more fibrotic as the years go by. It still does some T lymphocyte jobs, but not like it did in the fetus or in the infant. This is a slice of an adult thymus. Again, we got some patches of purple here as opposed to the whole thing being purple. Most of it, where the number 2 is and all the similar stuff, that is adipose tissue. Like, I'm not zoomed in enough here, but trust me, this is adipose tissue. And with that, like I promised, this was a short video, short topic. Gotta love it. That's our lymphatic lab. And as always, hit me up with your questions, and I'll see you later.